What if the person you think you are is just a fraction of who you truly are? What if years of conditioning and surviving in a challenging world have left you clinging to strategies and beliefs that mask your truest nature? I'm Catherine Duca, psychotherapist and self-esteem coach, and you're listening to Who Do You Think You Are? A show that looks beneath our psychological masks and uncovers our profoundly messy, beautiful, brilliant, tender-hearted selves. Join me as we go in search of the hidden power of our true selves. I'm so glad you're here. And you know that to be true. I am so glad you're here. Welcome. Welcome to Who Do You Think You Are? A podcast dedicated to helping you learn how to have the highest regard for yourself, how to live from a place of genuine self-respect and self-love, and how to make yourself a priority in your own life. Meet me here each week for curated tips and strategies designed to help you drop your psychological masks, connect with your truest essence, and simply live life more easily. Why? Because we know that when we approach life in this way, we naturally and effortlessly and organically have more room, more generosity, and more love for one another. And dear listeners, when have we needed that more than this very moment in time? I'm so glad you're here. So, interesting topic tonight. You know, I never really know exactly what specific topic I'm going to land on until perhaps a day or two or three before the show. I have a general sense, but I don't really land on a particular topic. I wait to be called or moved or for something relevant to something relevant that's happened in my life, either my personal life or my professional life with a client, in order to know what to talk about. So tonight, I'm going to talk about an interesting tactic that many people use in their relationships, and that is the silent treatment. The silent treatment. So tonight's show is entitled A Wall of Silence. That's right, a wall of silence. And I speak from experience. And what prompted this particular topic tonight was I was having an interaction with a friend just the other day. And it was kind of a spirited conversation. And then it turned a bit more intense. I think we were both invested in our points of view. And I believe I may have said something or expressed myself in a way that my friend did not appreciate. And I believe that to be the case because she, I think she gave me the silent treatment. She kind of abruptly ended the conversation. And normally we text every day, every couple of days or something. But a good couple of days went by and there was no text, and she didn't respond to my text. So I knew something was up. Has this ever happened to you out there? I'm sure it has. And we eventually talked about it. And truth be told, I did inadvertently, hurt her feelings, to be perfectly blunt. It was inadvertent. I didn't intend to, and I didn't realize I had. The silent treatment, radio silence, crickets, you know how it goes. And I didn't get angry, to tell you the truth. I mean, I could have, but I didn't, because I recognized that tactic in myself. Now, those of you who know me probably can tell that I love to talk. I love to hear other people talk. I love to process things. I love to talk about emotions. I love to get to the bottom of things. Love, love, love. It's not only my life's work. It's really how I am in my personal life. So, when this interaction happened with a friend, I quickly hearkened back to a time in my life, some time ago, when I believe I did the same thing. I gave people the silent treatment. And, in that moment, I actually had empathy for my friend because I know when I gave people the silent treatment, I know that I didn't really do it for the sport of it, although I appreciate the impact that it had, the negative impact that it had, the hurtful um, impact it had. Um, but you know, I was hurting myself at those times. And when I say hurting, I mean I might have felt frustrated. I might have felt like, um, I didn't know what to say. I might have felt stifled. I don't know, something like that. And my recourse was to shut down and withdraw, i.e., silent treatment. And this got me thinking about myself and the reasons that were behind why I did that and why other people do it. And so, as you listen to this conversation tonight and hopefully participate, by the way, if you are um, listening and have access to the chat, I invite you to comment, ask questions, share perhaps a different point of view. I welcome any and all participation. Let's co create the best show we can tonight. So, uh, it got me really taking a deeper look at not only why do people give others the silent treatment, but what does that convey in a relationship? And that took me to the whole notion of power, power in relationships. Power is intrinsic. It's a part of every relationship, not just romantic relationships, not just friendships, but business relationships, employer employee relationships. Virtually every relationship has a power dynamic. Now, interestingly, we talk a lot about boundaries in relationships. You've heard me talk about that quite often on the show. We talk about expectations, we talk about trust, but rarely do we talk about the power dynamic or the power differential, really, in relationships. So I'd like to do that tonight. And, you know, I think all of us have heard or been a part of conversations where abuse of power is talked about, right? So many things in our culture, the Me Too movement, and so many things. But in everyday relationships, I think too few people talk about power. So, power is really neutral, like many things in life. They are neither good nor bad, but it is how we choose to utilize, in this case, power, that is really the crux of the issue. So, you know, when we come into this world, we come into it an extremely dependent creature. We can't do anything for ourselves. We are completely dependent for our survival on our parents and our caregivers. So we need them. They hold the power, right? That's obvious. Now, if you've ever run into a toddler, a 2-year-old, you know that when the toddler refuses to do something and just won't listen, you know that the power in that instance is not from the top down, it's from the bottom up. You know that that toddler holds the power because the parents are utterly stymied. They don't know what to do to get their child to listen. They bribe, they cajole, they plead, they may give ultimatums, et cetera, because the 2-year-old has the power. Well, um, this happens whenever we depend on someone as adults, whenever we depend on someone, whenever we rely on someone, whenever we have expectations of someone, we
give them, or they have, in a certain sense, power, right? Now, within that power structure, there is power that is used over people. And I think this is so interesting and such an important distinction. There is power over, and then there is power toward or to. Or maybe a better way to say it, power in order to. I'll explain what I mean. You know, if someone earns more money in a relationship, right? And we hear about this all the time. And maybe you're in such a relationship. Maybe you earn more money than your partner, or maybe it's the other way around. We tend to think that the person who makes more money holds the power. That person may make some of the more important decisions in the relationship. That person may decide how to spend money, what purchases to make, where to vacation, things like that. That person is said to have power over that person. But there is also power to. So in power over, we can oppress, we can dominate, we can use our power for leverage to get our way, we can exploit others. This is what happens when we use our power in a way that we sort of lord it over another person. But then there is power to, in order to. And what does that sound like? Well, that sounds like, I know I make more money in this relationship. And listen, you've said many times that you would like to go back to school. I'd like to make that happen for you. Or you want to get back into the art world. Or you want to take time off to care for your parent who just had hip surgery. I would love to make that happen. That would be my pleasure. And in fact, that would be my blessing. So that's power used to nurture, to support, to enhance another person, right? So there you have power over versus power to. Now, when we pull something like, and I could say pull because I've done that, when we pull something like the silent treatment, we are attempting to gain power in that interaction. Even if your partner is the loudest person and turns up the volume all the way, to a fly on the wall, it may seem as though that person holds the power. But whenever someone relies on us, as I said before, relies on us to contribute to a conversation or to problem solve, for example, or to share a point of view to shed light on a situation, and we withhold that communication, that information, then the conversation can't advance. And what's more, the other person can likely feel upset. And if anyone has used the silent treatment on you, I bet that's exactly how you felt: frustrated, upset, demoralized. You didn't know what to do because you can't make someone speak if they don't want to. So the silent treatment is one of many conflict styles, and we'll get into that in a bit, that people use in order to express themselves, assert their boundaries, or assert their power when they know of no other way. Now, right off the bat, does that feel constructive? Of course not. Does it feel a bit destructive? I think it does, because it creates a gap. And if a gap exists long enough, you start to have a wedge between people. And really, nothing positive or constructive can come from the silent treatment. Now, the silent treatment is also, I'm sure you've heard the term, a passive aggressive move. What does it mean to behave in a way that is passive aggressive? Well, passive aggressive is really a great term because it really captures the essence of that behavior. It's passive because, in a precise way, you're not saying anything if you're giving the silent treatment. You're literally not saying anything. So it's passive. In essence, you can't be blamed for saying the wrong thing because you're not saying anything. But the energy on it, the emotional spin on your silence is one of engendering in the other person a sense of frustration or helplessness. Because what can they do? They're going to do what the parent of the 2-year-old does, because actually, to do the silent treatment, speaking from experience, it is like a toddler who refuses to communicate, who kind of, stomps their feet and folds their arms and says, you can't make me. And so the other person on the receiving end may do what the parent of the toddler does: cajole, plead, bribe, guess, give multiple choice, et cetera, et cetera. It's a very uncomfortable position to be in. It's really a tight squeeze. And therein lies the aggressive aspect of the passive aggressive behavior. So the silent treatment is really, though a common tactic that many people use, it is really one that we would do well to swap out for more direct communication. More direct communication. So, why do some people resort to the silent treatment? What is it that propels someone to go mute when in fact they have so much to say? Well, it's really a defense mechanism. It's a defense mechanism. Why do I say that? Because you have to ask yourself, what kind of home did you grow up in, if you're the giver of the silent treatment, or if the other person is? What kind of home did they grow up in? In other words, was it acceptable to express anger? Was there room to display displeasure? I don't think I'm talking about grand acting out, but verbalizing. I'm upset about that. I'm not happy about that. I feel angry about that. Was silent used as a punishment in your home? If you had a parent who, when he or she got angry, withdrew behind a closed door or kind of slammed the kitchen cabinet doors but didn't say anything, and you were there as a child just to absorb that energy and you couldn't do anything about it, that could very definitely convey a message that gets internalized of, it's not safe to express a difference of opinion, a disagreement, certainly not safe to express anger. So shutting down became a way to dodge bullets, to stay under the radar, to not rock the boat, So it became a survival mechanism. And anything that's a survival mechanism is really a defense mechanism. Sometimes people shut down because they feel a type of overwhelm or what's it called? A sensory overload. Things in the environment are just too staticky, and so they can shut down. Now, that's not necessarily an anger move or a power move, but that's another reason why people go silent on their feelings. There's just too much stimulation happening, and they can't sift through it all. So that's another reason. One more is they're afraid of generating a conflict. Why? And this is at the heart of so many defense mechanisms, because if I upset you, if I'm a child and I depend on you, my parent or my caregiver, and I upset you, I'm afraid you're going to withdraw your love. I'm afraid you might reject me. And if I'm a child and I'm dependent on you, I cannot afford to do that. No how and no way. Therefore, I will just, swallow my feelings and just go undercover. These are things that we do. We learn these traits, or we develop these traits, or resort to these traits in childhood that get internalized. And then as we get taller, those traits remain intact and they remain ingrained in us. And then we try to, get somewhere with difficult conversations with people, friends, family, and we hit a snag. We hit a snag. So I find all of this very, very interesting, and I find it extremely common in my work with clients. So let me know if you have access to the chat and you'd like to participate. Let me know if you relate to this at all, if you've ever given the silent treatment, or if you've been on the receiving end of such. I see we do have a comment in the chat. Let me say hello to Janine. Hi, Janine. Welcome. Saying nothing is construed as not communicating, but silence communicates a lot, none of it positive. Yes, that's true. That's true. Saying nothing is construed as not communicating, but it is not a vacuum. It is not a nothing. Silent communication carries an energy, and you're absolutely right, Janine. None of it is positive. It's not positive because it's usually, if not always, conveying a hurt or a pain or a displeasure. So in that sense, it's not positive. Very few people go quiet when they feel joy, when they feel love, when they feel empathy, when they feel exuberance or excitement, right? It's when we feel pain and hurt, we tend to get quiet. And it's not positive because it isn't constructive. It doesn't advance the conversation. So, Janine, you're absolutely right. So, I think that this might be a good time to take a break. Let's digest this business of power plays in relationships and give some thought to your own interactions and your own conflict styles. And when we come back after the break, I'll take a question or two and we'll continue this conversation. You're listening to Who Do You Think You Are? I'm Catherine Duca, your host, psychotherapist, and self-esteem coach. Stay with me. And welcome back. You're listening to Who Do You Think You Are? And I'm your host, Catherine Duca. If you're just joining us, you came in at a good time because we are talking about tactics that many people use in their relationships to assert their power and their boundaries, but they are not necessarily the most constructive tactics. And we are talking specifically about the silent treatment. The silent treatment is when someone is depending on us for something, a communication, help, problem solving, or some other contribution, and we intentionally withhold that information. And we literally go silent. We don't communicate. And we're talking about some of the reasons for that because it's really essentially a defense mechanism, probably has roots in childhood where, you either were on the receiving end of the silent treatment, or you gave the silent treatment as a way of staying out of trouble, conveying your displeasure without having to take ownership of it. And these are tactics that, if developed in childhood, probably stay with us through adulthood until and unless we go in, introspect, examine them, deconstruct them, look for a better way, and act differently. So this is what we talked about in the first half of the show. I'm going to take a couple of questions, but I see someone has joined us in the chat. Let's see. We have at Ask Jewelry Company. Hello there. In the middle of this right now, on the receiving end, have been the initiator in the past, of course, I really try to be aware of my behavior to take responsibility for my feelings. So you're in the middle of this right now. You're on the receiving end, but you've been the initiator. Well, I would say in a pinch that if you're experiencing the role reversal, I would use your words if you can kind of ground yourself in case you're upset, annoyed, or angry. If you can go inward, ground yourself, and remember the times when you did the silent treatment thing, and try to put yourself in the other person's shoes and try to communicate to the other person. I would offer how the silent treatment makes you feel. And I would try to speak in the I statement, you know, when you don't communicate, I think it's okay to say that because the person isn't communicating, and that's a fact. I end up feeling distant from you. I end up feeling blamed, or I end up feeling like I don't know where to take this. It makes me, I begin to feel anxious. I really feel uncomfortable. Could you let me know exactly what you're experiencing right now? I'm open to hearing it. And I promise you, I will do my best to keep my reaction in check. I really want to know what you're thinking and feeling right now. So that would be my advice if you're on the receiving end. Try to put yourself in the other person's shoes, go back to when you did it, and remember how uncomfortable you felt in those times, and appeal to the person and reassure them, because I don't know, but it's possible that the other person might be giving you the silent treatment because they are anticipating a bigger reaction from you. It could be that person is trying to punish you and trying to make you, just so frustrated, make you feel like a balloon that's about to burst. Well, you can put that in words also, but my advice always, if you can, is not to use you, because that's blamey. And that just gets the other person's back up and you're not going to get anywhere. But when this behavior happens, I feel this way and that way. Okay. I hope that helps. Let me know. Dawn. Hi, Dawn. My mother used the silent treatment because she couldn't tolerate my being emotionally separate from her. Usually when I disagreed with her, it was painful and impactful for me as a teen. Your mom used the silent treatment because you don't think she could tolerate you being emotionally separate from her. Well, that's a very interesting thing, Dawn. What does it mean to be emotionally separate from another person? We talked last week. Let me see if I can follow my own thread here. We spoke last week about dependency in relationships. Remember, if you were with me, we talked about dependency in a relationship, codependency, dependent dependency, and the sweet spot, the healthy spot, which is interdependent. When people find themselves in a codependent relationship, usually at least one of the two people does not express their anger because they simply don't feel like they have the room to. They feel like they're going to be retaliated against. It simply isn't safe or comfortable to express anger. In that sense, you don't have two separate people. Now, of course, you have two separate people standing there, but emotionally, psychologically, there is not what can I call it? A psychic separation. Here's what I mean. In order to feel and express anger toward another person, I think this is so interesting. You have to declare your independence, as your autonomy as a separate person. In order to say, I feel angry toward you right now, or, you made this comment or you did that behavior and I feel angry about it. There has to be some room between the two of you. In a codependent relationship, the presumption is, like, I need you too much. I can't tolerate you having your own emotion toward me. I'm too afraid to have you be angry with me. And if I tell you I'm angry with you, you might in turn be angry with me because I'm angry with you. And I can't tolerate that. And so, Dawn, maybe that's what you mean when you say your mother couldn't tolerate you being separate from her. Maybe she needed you to be kind of merged with her. And we do this in relationships, and it's called codependency. You go on to say, it took a long time for me to realize she couldn't tolerate her feelings, fear, separation, and didn't have other tools. Right. So it sounds like you eventually got to empathy for your mom, Dawn, which I think is, really, that's, talk about the sweet spot. Look, if we can be willing to be willing to see past the masks we all wear. I wear them, you wear them. If we believe one another's masks, we're going to have a very limited relationship. We're going to have very limited intimacy and closeness because we believe the act. And masks are a costume, a masquerade of sorts. And so if we all walk around and relate to one another, mask to mask, how deep can we really go? How can we really embrace anyone else's authenticity? How can we embrace our own? So I think the name of the game really is to get to a place where through self-reflection, we empathize with ourselves. Oh yeah, I know why. Because when, once I said I was angry at my father and he slapped me. And ever since then, I made a vow I am never doing that again. So I'm just going to swallow my feelings. And what happens, happens. Whatever the consequences to me are. We don't even know what the consequences are. But we get into a relationship in adulthood and things go awry and we don't know how we got there and we don't know what to do to correct it. But when we unpack these things through therapy, that's one way, we find that the way we negotiate conflict is by using these non-constructive tactics. Okay, I hope I'm being clear. Let me know if I'm not. Michelle says, that is very evolved thinking, Dawn. It is. It took me quite a while into my adulthood to understand why my mother needed to use that tactic. Right? Well, better late than never. And some people, sadly, many people have a never. They never really. Why? Because they don't know about self-awareness. They haven't been taught or inspired to develop self-awareness. They are not used to introspecting. They're used to changing things in the outside world, not in their internal world. And so some people never get to understand. But when you do, Michelle, tell me if you can, if you care to reveal this, what does it do for you to be able to have that level of understanding and empathy toward your mom? Or Dawn, let me know that as well. Michelle, you go on to say, to this day, when someone goes radio silent on me, it's a trigger. Of course it is. I do have a deeper understanding, however. It takes me a moment to really center myself when someone does that to me in the present. Well, you're working with it. And I always say, when we work on our issues, especially our deepest ones, it is not like we get to a point where we flip a switch and we have arrived on the other end. It really doesn't happen like that. Working on our issues is more akin to a dimmer switch, I think. We get better and maybe we relapse a little bit because we're triggered and we're overwhelmed, but we have enough understanding to say to ourselves, yeah, okay, I know what this is. I'm triggered because this takes me back to my kitchen table when my mother did X and slammed the cabinet doors but wasn't saying anything. Oh, I know. I have empathy for myself because that was really a tough spot to be in as a child. And as an adult now, I can have empathy for my mom. This does take a minute, but the good news is it's a minute or a day or something like that. It's not never, and it's probably not weeks or months. And if it is weeks or months, well, accept that. And the realization comes when it comes. You know, I hear so many people say, and this makes me very sad when they say, when they beat themselves up because they say, I should have known this sooner. I'm this age and I'm still triggered by that. I can't believe it. What's wrong with me? I should have resolved this long ago. Probably not a week goes by. I don't hear that from someone, my clients usually. So let's all cut ourselves a break. We're all doing the best. And if we're actively working on these issues, we're doing right by ourselves and we're doing right by the people we interact with. So, Michelle, I understand my mother had her own challenges. Yes. And going silent was a coping mechanism for her. She did not have strategies and coping mechanisms to deal with the challenges I was as a teen, to deal with the challenges you were as a teen. Well, what teenager isn't challenging, Michelle, right? But you know, some parents do better with infants than they do toddlers, some toddlers than tweens, and some young adults than at any earlier age. Different parents have different, you know, they're equipped differently. And I do believe that most parents, if not just about all parents, do the best they can with their capacity and their competence. I have seen very, very few people capable of better, but withholding their better. In fact, I would be hard pressed to recall anyone who does that. So if you have skills, if you have coping, as Maya Angelou says, I'm smiling because it was not Dr. Phil, it was Maya Angelou who said, when you know better, you do better. And that's so true. And most people, if not all of us, love to do better. We love to have mastery over ourselves. It's an adult empowered kind of a stance to say, I can handle what I feel. I can handle what you feel. I can handle what you feel toward me. I don't have to go passive aggressive in order to hold on to you, to make you not mad at me. And by the way, if you engage in passive aggressive behavior, you're guaranteed to have the other person be angry with you. So what does that mean? That means the very thing you were trying to prevent using this tactic is the very thing you end up co-creating with the other person. So keep that paradox in mind. Michelle says one more thing. Also, silence went with secrecy in my home. It often left me wondering what was going on, and it deeply affected my sense of safety. Of course, silence was associated with secrecy, and secrecy leads children and young people not only to wonder, not only to guess, but something even more damaging. And that is because we're always looking, especially children, always looking to make sense out of life, always looking for an explanation. Children insert themselves in that equation. If mom is doing this, she's not speaking to me, going radio silent. It must be because I'm difficult. And we can easily, as children, invent a story that fills in the gap, that explains to ourselves why mom is acting that way. I mean, it could be way off base. We have no way of knowing. But because living with uncertainty is so anxiety provoking, so anxiety provoking for so many, especially children. Children invent explanations that usually involve self-blame. So you don't know what's going on. You tend to think the worst. You have a made up story and you believe accordingly. And so there's a whole layering up of something that may not even be real. It may not be accurate. But these are the things that can happen when you have this kind of silence, when this kind of tactic is used, and when secrecy is a current in the home, a current, right? Thanks, Michelle. Thanks for sharing that. Janine, boy, thanks so much for these comments. I just love it. I think it makes the show come alive and the material come alive. Janine, I have walked away from friendships for this type of behavior. It just feels so ridiculous and immature, and I just have no room for that in my life. I am a communicator. Well, certainly your prerogative. I think each of us has a choice to say to the other person, listen, this, I told you how I felt, right? I feel frustrated. I feel anxious. I feel like, I don't know what to do here in this conversation. After you make your appeal, if that behavior still stands, I think it's your prerogative to protect yourself and say, listen, I think I have to have some space right now. I think I have to take my leave, whether that's for a week, whether it's for a year, whether it's indefinitely. I think it's one's prerogative. Okay. I think now, if it's a good, if it's someone if this is a behavior that isn't a constant, maybe you can work with it in the ways in which I'm discussing. But if it is a constant, your choice, because adhering to your personal boundary of safety and comfort is, of course, a priority. That's what we talk about here. Fat ass jewelry, you're back. Glad. The silent treatment goes back to my father. He simply wouldn't talk. You see, what doesn't go back to childhood? Because if the conversation started in adulthood, we're all smart. We've all read the books. We've all had the conversations. We know what's happening intellectually. But inside of us is a frustrated, wounded, hurt child. And if we never went in and did work with our inner child, time has a way of standing still for us. And that inner child remains rigidly in place. And so it is up to the adult in us to mentor, if you will, that inner child and give that child the time of day, meaning through introspection. I know what you were thinking and feeling when Dad did that. But let me go back in here. Perhaps I've jumped ahead. The silent treatment goes back to my father. He simply wouldn't talk. He didn't have to be mad. So odd to me now when I think about it. I was a child and would ask him something and he would ignore me. That sounds just so unpleasant and so concerning. And if I could step back into that home movie of yours, I think I would want to talk to your younger self. And I invite you to do this with your younger self and just give yourself empathy and compassion for how difficult that must have been. The thing to ask yourself, and for all of us to ask ourselves, is to what extent is that impact still locked in us? To what extent is it still dormant within, I'll say within me? And when does it get triggered? And when it does, how do I react to my own trigger? Because listen, wouldn't it be a lovely world if we could say, hey, here's the memo. This triggers me, that triggers me. Here's the manual on everything that triggers me. do not do any of these things. Please. I do not want to be triggered. Wouldn't that be a wonderful world? We all know the world does not work that way. Where two or more are gathered, there will be triggers. It is up to us to handle our trigger. It is not up to the world to stop triggering us. As I say all the time, in a relationship, you're not responsible for your partner's triggers. I think it's constructive and healthy and loving to be aware of them and be sensitive to them and not go out of your way to trigger your partner. But, you know, we're all behind the wheel of getting to the bottom of our own triggers. Now, I'm not saying that, I'm not saying that you do this with your partner. I'm just making a general statement. But I do think anything we can identify in childhood as a behavioral pattern, we want to look for, how is that pattern showing up today? Under what circumstances? And what do I do about it? I hope that helps. Okay. I think I'm going to go to a question that came in today. Today's newsletter dealt with this topic. And incidentally, if you'd like to receive a copy of my newsletter, just email me at Catherine@CatherineDuca.com, Catherine@CatherineDuca.com, and add me in the subject line, and I'll know what you're talking about and what you're requesting, and you'll receive a copy of the newsletter in your inbox every Sunday morning at 5 a.m. So I want to take a question, but I can't ignore this comment because it's good. I think it informs everything. Big picture is I have picked partners who do this in some way. Well, that's an interesting insight. This will not come as a newsflash to anyone who listens to this show. We gravitate toward what is familiar, even if what is familiar feels like what our parents and caregivers did or behaved in such a way that we did not like. We are homing pigeons. We gravitate toward what is familiar. And unless we have, enough insight, we're going to keep repeating that pattern. And in fact, this is, that's normal. And until we work through it enough, we can throw one person back in the lake, if you will. The next person might be a slight upgrade, but will still have the essential qualities until we clear it enough in ourselves. Will we ever clear it 100%? Probably not. But we can go a long way toward 40, 50, 60, 80, 90% clearing. But it takes work. It takes work. I call this delicious work. I hope you'll agree. Quick question, because I wanted to get to this, because I think, although it's a specific question, I think it pertains to many people. Pardon me. Okay. This is from Myra. Myra wrote, how can I address the power imbalance in my relationship when my partner doesn't acknowledge it? Maybe this gets to some of what that last listener was saying. How can I address the power imbalance in my relationship when my partner doesn't acknowledge it? Well, start by expressing, as I said before, your concerns and your feelings in as non-accusatory a way as possible. Use I statements. We talked about that last week. Use I statements. I'm feeling like I've been shouldering the lion's share of the household responsibilities or the expenses, and it's making me feel overwhelmed. Can we talk about how we might share these things more equitably? Now, you can imagine, and I can certainly imagine myself, a time in my life when I might have come on like gangbusters and said, you leave me to do the lion's share of everything. What do you think that does to me? Do you think that's fair? What's wrong with you? What are you doing? You're asleep at the wheel. I mean, come on. How far do you think you're going to get with that kind of a conversation? I can tell you from experience, not very. So when you speak in the I statements, I feel overwhelmed, I feel burdened, I feel anxious. Can we talk about how we can make things more equitable? The other person might not be aware for reasons pertaining to their upbringing. What is blatantly obvious to you and a pain and a burden may not be obvious to the other person. Now, maybe it is obvious, and for reasons of dependency, they are letting you take the lion's share. I mean, there are layers to this, and I don't want to oversimplify and broad brush everything. But I think as a starting point, we always want to start with I statements, and we always want to appeal to the higher consciousness in the other person in the interaction. If you start off you, blame, 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 accuse, 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 you're done before you start. But if you appeal and you turn your complaints into pleas, PLEA, if you turn a complaint into a plea or into a request, I think you're less likely to get the other person's back up. They are more inclined to hear you, or to at least be receptive, or at least to be willing to be receptive. You're not going to keep playing to that same old groove, because that is a well-worn groove, you, and it only has one reaction, and that's this: shoulders up, back up defensiveness. So, a very interesting conversation, power dynamics, tactics that we use to assert our boundaries. Listen, the best thing we can do is learn to take ownership of our emotions, our triggers, our unhealed wounds. Because yes, other people are going to trigger them, but they're not necessarily or mostly ever the root cause of the trigger. The root cause is between you and your history, you and your past. And it is the mission of adult living, I believe, to explore ourselves and try to get to the bottom of that. That is treating ourselves with more self-respect, I believe, and self-love. And it's making ourselves a priority rather than making our priority grooming the other person to not trigger us or punishing them for triggering us. It is the exquisite mission of adulthood to love ourselves into wholeness and into integration and into becoming the kind of person that can say, I'm triggered and it might take me a moment, but I know it's mine. It belongs to me. So I'm not going to give this to you or dump this on you. Nor will I accept if you try to dump yours on me. I will let you know in a kind way. I think this has your name on it and I'm here to support you, but I'm not here to absorb it. So friends, I could talk as always for another hour. I don't know, I may have a sequel after these great comments and questions tonight. There is so much to the art of relationships, the art of closeness and intimacy. And we're going to be talking more about that in the next couple of episodes. So until then, thank you so much for your time and attention tonight. I love this hour together with you. I love co-creating what I think is a very thought-provoking, interesting, and valuable show. I hope you'll agree. I'll meet you back here. Till next time, have a great week. Be well. You've been listening to Who Do You Think You Are on New Thought Media Network. Take care.